my name is Mary Donovan, and in this speech tonight I'm going to inform you about elder abuse. America is getting old, it's true. According to the fact sheet on aging in America, people aged 65 and older will go from 12% of the total population in 2000 to 20% of the total population in 2030. The elderly are an easy target for abuse because they are sometimes weak, they can be dependent on their abuser, they're also often isolated from their community, and they can become confused or not even remember about their abuse because of age-related memory problems such as dementia. Elder abuse is something everyone should know about because everyone knows someone who is elderly, and many people who are watching this will be responsible for the care or decisions regarding the care of the elderly family members. There are many forms of elder abuse, but in my speech I'm just going to talk about physical abuse, emotional abuse, and neglect. I will inform you about what elder abuse is, who abuses the elderly, the signs and risks of elder abuse, and how to prevent elder abuse. The definition of physical abuse is often assault, such as hitting or shoving, but it can also be problems with medication, such as withholding medication that the elderly person needs, or over-medication. Emotional abuse can take the form of humiliation and intimidation, or making the elderly person feel guilty that they are a burden on their caregiver. Neglect is defined as abandonment or the failure to provide things such as food, shelter, clothing, medication, and good hygiene for the person, by the person who has taken on the responsibility of caring for them. Now that you know what elder abuse is, you should be aware of the prevalence of elder abuse and who the abusers typically are. According to the National Center on Elder Abuse Administration and Aging, 2 to 11% of elderly people are abused, and they estimate that only 1 in 4 cases of elderly abuse is reported. Now, we've all heard horror stories about nursing homes, the neglect, people being abused in nursing homes, and there are those stories. It's true that people do get abused in nursing homes, but 2/3 of abusers of elderly people are family members, usually close family members such as a spouse or children. Now, it isn't always easy to tell if someone is being abused, and you can't always stop it, but there are risk factors and signs that someone is being abused, and there are ways to prevent it. Some risk factors include a past history of domestic abuse in the household, such as if one spouse abused the other when they were younger, that abuse is likely to continue on into their older years. Also, if a parent abused a child, that child is more likely to abuse the parent when their parent is elderly and they are caring for them. Another risk factor is living in isolation, especially if the caregiver is living with the elderly person and they don't have a lot of support from their community. Dementia or other memory loss or confusion related to aging is another risk factor of elderly abuse. The caregiver's inability to cope with stress can also cause them to abuse an elderly person. And a lot of people who abuse the elderly have problems of their own, such as depression, alcohol use, drug use. And the lack of support for caregivers is another big problem and a risk factor for elder abuse. The signs that someone is being abused is arguments and tension between the caregiver and the elderly person, unexplained injuries such as bruises, broken eyeglasses or frames if the elderly person wears glasses, or the caregiver's refusal to let you see the elderly person alone. Prevention of elder abuse is very important, and that's why I provided a handout for that. And general prevention is just to listen to the caregiver and the elderly person, and to educate yourself and others about elder abuse. Caregiver support is a very good way to prevent elder abuse. You can, if you're the caregiver, you can request help from others and seek out things like adult daycare so that you can have some time for yourself. You should also try to reduce your stress by doing things like exercising, positive thinking, and deep breathing. And seek counseling if you are depressed or have drug or alcohol problems. When you're finding caregivers for your elderly relative, make sure that they have a lengthy background check. Now that I've told you about what elder abuse is, who the abusers typically are, the signs and risk factors, and ways to prevent elder abuse, I'd like to end with a short story. My job that I worked for a year and a half was to work taking care of elderly people. And I worked with people who had dementia and memory loss problems. And a lot of times it would have been easy to just not do what I was supposed to be doing. They wouldn't even remember. Sometimes I had to spend the night, and I'd have to get up in the middle of the night with them to go to the bathroom, and it would be easy just for me to stay sleeping. But that would have been a neglect, and it was often frustrating, but I always got up when the alarm that told me they were awake went off, and because I took pride in my job and I thought it was important and it was rewarding. Thank you.